So we're gonna work on the anterior mobilization of the cervical spine. So we got to find our landmarks. So we have our SCM, which we can find by turning the neck to the side and lifting up, so it pops out. So that's kind of our lateral border, and then our medial border is going to be the jugular, or the Adam's apple just there in the throat. And then I'm going to take in my other fingers from the lateral. I'm going to poke into the transverse process so that I have a target for where I'm going to approach the mobilization from. The application of this mobilization is really for the anterior shoulder paresthesias. I'm then going to use a dummy thumb, which in this case is going to be my left hand, and then I'm going to gently come in. I'm going to approximate the tissue of the neck such that it kind of hides my pressure, and then the whole thing is going to oscillate like this. And my vector of force is almost purely down with a slight medial bias. So I'm kind of going in at that angle in alignment with my thumb. And we're going to go gentle, just given the sensitivity of the structures in the neck, as well as the amount of high innervation. So if we were going to self-mobilize this, okay, so then you're going to bring your hand up. We're going to use this thumb as our dummy thumb. So I would go like this. Right, so you go in like that. Can you feel that? Okay. And then with this hand, you're going to get this elbow high. And then, yeah, so your contact point is that thumb. And then you're going to gently try and oscillate kind of like straight down towards the pillow and maybe slightly in towards the middle of your neck. And it should be a pretty consistent ebbing and flowing, almost like a breath, if you will. Okay, so the thumb almost remains rigid, and the whole thing pulses as a unit. And then you can move yourself up and down segments of the spine to find those areas that are a little bit more tender and that are a little bit more associated with your quote unquote like normal symptoms or your chief complaint.